everyone. We're glad you're with us today for our exclusive discussion for HealthStream customers entitled Bending the Attrition Curve, Financial Wellness at Phoebe Putney. One of the challenges that seems to be a constant for all of us in the industry is that of workforce retention. And as you know, there is a correlation that's been proving between the financial well-being of staff and their engagement at work, and engagement at work is correlated highly to retention. But I wanted to take just a second and tell you a little bit about Phoebe Putney Health System. I'm sure many of you are aware of it because they have a national reputation for being innovative. But Phoebe Putney Health System serves a 41 county area in southwestern Georgia. They have over 5,500 physicians, nurses, and professional staff. And we should say congratulations to them because just last month they were named to Forbes' ranking of America's best employers.
But financial health, as we know, is a huge challenge for our caregivers here in our health system. I would imagine with other health systems as well. So we really wanted to zero in on finding a tool that could help address some of the concerns that our employees are facing dealing with financial matters. And so we have partnered with Plannery over this past year, and we've seen some positive results and really it's helped employees being able to tackle debt, and particularly with credit card debt, and seeing some reductions there. So it's really been a very well-received program over the past year.
Tell us a little bit about just kind of the prevalence of financial stress that you hear your colleagues and team members facing.
It's certainly a stress that we hear a lot about from our staff and our employees, and it's been really an eye-opening experience of this past year to hear some of the stories behind the debt that employees or the financial challenges that employees have been facing. So it's been a great tool to be able to offer something to employees to help them with that debt. And so it's feedback we've heard through our employee opinion surveys, be able to offer these type of tools for our employees to be able to address things that really cause stress in their lives. And so we want to, as part of our well-being approach here at Phoebe, really wanted to try to address things that our employees are facing on a day-to-day basis.
And you hit upon the debt that some of these nurses have. We instituted other programs at Phoebe, like helping on tuition assistance, but helping on personal debt was something we didn't have. And so we implemented this, and it was a great fit for everything else that we do at Phoebe to help employees.
Anthony, tell us a little bit about just kind of how you evaluated this, and then how you kind of communicated this need and this solution to your peers in leadership.
When I heard about this tool, I thought this was another way that we can have a form of engagement with our employees. And with engagement, the more engaged our employees are, the better we are from a retention standpoint. And where we have better retention, that's a cost savings for Phoebe. So we can do two things. We can help our employees while at the same time getting return on investment by having better engagement and retention from employees as well. So that was my pitch to senior leadership. And one great thing about Phoebe is that we try to be innovative from a solution standpoint. And I hadn't heard of anyone doing this before. So we don't mind being cutting edge here at Phoebe as well, if it makes sense. And this certainly made sense because we're impacting employees' lives, and we're also really helping the organization by having better retention and engagement with our employees and our workforce.
Now that you've implemented this in Phoebe and to your employees, what kind of feedback are you hearing, and how are you all judging kind of the impact, if you will, of the partnership with Plannery?
One of the things that we've done during our partnership with Krish and Plannery is that we look at the metrics on how many employees have signed up for it, and we look at the savings. And if you look at the amount of dollars that employees are saving, we are impacting lives from a financial well-being standpoint. By lowering the amount of debt that folks are paying back from an interest rate standpoint, there are real savings and real hard dollars. we can't always go out as a healthcare provider, as a system, and pay more to you in your base salary or what have you. But we can help you with your take home at the end of the day if you're paying a lot less to a credit card by having a program through Plannery.
It really is hard dollars. I mean, if you're talking about giving nurses raises, well, here's a raise by lowering your debt. It's just as impactful, per person, maybe $2,000 a year that we're impacting them.
As Anthony and Joe referenced, you have data on how this is working. And
the past 12 months, 28, almost 30% of employees have actually applied with Plannery. And we're proud to basically share that we are improving retention among the folks who are using Plannery by about 76%.
How much does this cost, and how big of a lift is this to get this implemented?
I'll put my hands up because we were hands off pretty much. And Plannery did all the work. They made it so easy for us to implement. It's really one of the best benefits of me putting this in at Phoebe was that it was no cost to Phoebe. It was not any administrative burden whatsoever. And it was, and I've just been amazed that we were able to have this benefit.